everybody, this is Professor Jordan and welcome to my teaching session on critical thinking and clinical judgment. Specifically, how can we use these principles in the clinical setting when caring for our patients? Now, before we get started, I did want to refer you to the worksheet that you can use to follow along with and take some notes as we go through this presentation. Okay, let's get started. Now first, let's review our learning objectives. So our first objective is to define and describe the terms critical thinking and clinical judgment. Next, we're going to develop prioritization strategies for the clinical setting. And finally, we're going to apply the principles of critical thinking and clinical judgment to various different clinical scenarios. Now, before we get into the application of these two principles in the clinical setting, let's begin by discussing what these terms mean. First, we have critical thinking. Now, I know sometimes when I have difficulty understanding a concept, I like to examine the root of the word. So the word critical is actually an adjective and is defined as involving skillful judgment, providing textual variances or differences, and pertaining to essential and decisive importance when considering the outcome of an event or an action. So essentially, critical thinking is the purposeful and complex analysis of an action or an event in order to form a judgment. So in the previous slide, we identified that critical thinking is the complex analysis of an event in order to form a judgment. So in essence, critical thinking is the foundation of clinical judgment. Now, nursing is considered an action-focused profession. We are constantly acting and interacting with our clients and families, other members of the interprofessional team, as well as the environment. So if critical thinking is the thinking piece, the foundation, then clinical judgment is the doing. This is the action piece of the profession. Now let's pull in the nursing process. So if critical thinking and clinical judgment are about the thinking and the doing, then what do you think are the two most important steps in the nursing process? Well, if you thought the assessment and the implementation are the two most important steps, then you would be right. Now, critical thinking and clinical judgment are both nursing skills, just like placing a Foley catheter or performing a sterile dressing change. And just like any other skill, practice makes perfect. I like to think of critical thinking and clinical judgment as muscles. Now, if you want to have nice, strong muscles, you have to exercise, and you have to challenge these muscles to get bigger and stronger. So let's exercise our critical thinking and clinical judgment muscles together. The three exercises we're going to perform in order to develop these muscles are what I like to refer to as the 3 Ps. These 3 Ps stand for prioritization, being proactive, and patient safety. This process of thinking can be applied to your clinical practice, when caring for patients, in simulation experiences, and even in case study and practice question activities. And we're going to do some of those here in just a little bit. Now you may want to pull out your handout and take some notes on the next 3 slides. The first P is prioritization, prioritizing the leading needs or concepts related to our client. And as we practice this, we're going to develop prioritization power. Now, there are several different strategies that can help us with this prioritization. The first is the ABCs, airway, breathing, circulation. Everybody's familiar with the ABCs. In many cases, airway and breathing take a higher priority than circulation. But can you think of an event that circulation might take a higher priority? Let me give you an example. Consider a patient in diabetic ketoacidosis who has a respiratory rate of 32 breaths per minute. Now, although 32 breaths per minute is abnormal, this is actually a good thing since they are in a metabolic acidotic state and their elevated respiratory rate is an attempt to compensate. So, although airway and breathing seem to take a higher priority, circulation, or the elevated blood glucose level, is actually the priority in this situation, in this example. Next, we have Maslow's hierarchy of needs. Now, this is the theory that places basic physiological needs as a higher priority than psychological needs. Okay, I always teach my students that airway, breathing, circulation, and then following that comes safety, and then pain, and then any education needs. Okay, so placing those physiological needs as a higher priority than the psychological needs. Next, we have actual versus potential. Now, in many cases, an actual problem takes a higher priority than a potential problem, right? If we have someone that has an actual problem of vomiting, that takes a higher priority than a potential problem. Maybe somebody who's experiencing nausea. But let me throw a curveball. Let's say you are caring for 2 clients. One client is in for vomiting. They have some kind of GI virus and they've been experiencing frequent vomiting. All right, that's an actual problem. But you also have a client who is admitted for a, let's say they're having some kind of spinal surgery. They had some kind of injury to their cervical spine and they had surgery on that. So they're in a cervical collar to immobilize their cervical spine and they are complaining of nausea. So in this scenario, the potential for nausea takes a higher priority than the actual problem of vomiting because of the risks associated with that potential problem. If we have a client with a cervical spine injury complaining of nausea, there are a lot of potential risks involved if that progresses to actual vomiting, protecting the airway, maybe disrupting the cervical spine. So that would be a scenario where a potential problem could take a higher priority than an actual problem. Next, we have acute versus chronic. Acute conditions versus chronic conditions. In the majority of situations, an acute condition will take a higher priority than a chronic condition. Okay, an example would be the client suffering from COPD being managed with medication and oxygen. This client would be considered chronic until there was an evidence of some kind of respiratory distress, all right, at which time this client would become acute. So in many cases, it has to do with, disease management and the severity of symptoms. Next, we have least invasive versus most invasive, okay? And this is what we need to consider with our nursing interventions. It's important for nurses to consider the least invasive options before increasing the client risk of injury with an invasive option. For example, if we have a male client who is incontinent, it is less invasive to stand the client at the bedside every 2 hours to help with a urinal versus applying an adult diaper. All right, standing the client would be a less invasive intervention. Now, if we take this a step further, applying an adult diaper is going to be a less invasive option than applying a condom catheter. And then taking that a step further, applying a condom catheter is going to be a less invasive option than placing an indwelling Foley catheter. So when you are considering nursing interventions, including medications, you need to consider the least invasive versus the most invasive. Okay. Lastly, we need to consider safe practices, and we'll talk about this as one of the 3 P's, but we need to consider the safety of our client at all times. Now let's talk about the second P, or being proactive. Being proactive means thinking ahead and anticipating any potential harms or complications that could occur with your patient. Now, being able to proactively anticipate potential complications or harms is really difficult to develop, especially in the moment. Now, this is why it's essential to exercise this muscle. Now, keep in mind the nursing strategies that can be implemented quickly that have the potential to also help your client quickly. All right, consider what can the nurse do now that can help the client. So let's read the following question. A client enters the emergency department with shortness of breath, pedal edema, and reports sleeping in a recliner chair for the last 2 nights. What would the nurse do first? Okay, so here we have to prioritize and we have to be proactive. So what can the nurse do quickly to help the client? What do you think? Well, if you chose number 2, elevate the head of the stretcher, you would be correct. All right, this is an action and intervention that the nurse can do quickly to help the client to produce a positive outcome. All right, good job, guys. Lastly, we have patient safety. Now, I know I've identified patient safety as being one of the 3 P's, but patient safety is really threaded throughout critical thinking and clinical judgment. Now, with patient safety, we need to consider what are the top safety concerns for the client. Now, your NCLEX exam is an exam essentially about safety, and many of the questions are going to address client safety or discuss some kind of threat to client safety. So because of this, it is important to consider the highest concerns for safety experienced by the client, all right? Either in prioritizing risk or prioritizing potential risk with our interventions that we incorporate. So keep this in mind as we are reading through some of these NCLEX style questions. So prioritizing these safety needs will not only help you with test taking, with your exams and with your NCLEX, but this will also make you a better practitioner. So let's practice our critical thinking and our clinical judgment with this NCLEX style question. So we have a client who just returned from surgery who reports shortness of breath and chest pain. So what should the nurse initially administer? So this question is asking us to prioritize. Now, before we look at the answer choices, let's first think about the question. Well, we have a client who is reporting shortness of breath and chest pain. Now, we know that these are both symptoms of some kind of physiological issue, but we don't know what that physiological issue is yet, right? However, the question is asking us to perform an intervention. So, if we're performing an intervention, we need to think about least invasive versus most invasive, right? That's how we prioritize our intervention. So we have 4 options. First, we have supplemental oxygen. Next, we have IV morphine. Third, we have endotracheal intubation. And fourth, we have sublingual nitroglycerin. Now, of those 4 choices, which would all be appropriate for this type of patient who is experiencing shortness of breath and chest pain, of those 4 choices, which would be the least invasive to the patient? Did you guys choose supplemental oxygen? Well, if you did, you would be correct. So supplemental oxygen would be the least invasive intervention for the nurse to implement. Good job, guys. Okay, let's do one more just for fun. So a client enters the emergency department with shortness of breath, pedal edema, and a productive cough. In triage, the client is assessed and blood for lab studies are being drawn. The client's BNP levels are elevated, there are crackles throughout the lung fields, and the client's arterial blood gas includes a PaO2 of 60. What would the nurse anticipate to administer first to the client? We have A, a normal saline fluid bolus, B, morphine intravenously, C, a stat dose of furosemide, or D, a digitalizing dose of digoxin. Now, the highest level of question projected on the NCLEX is the analysis. So these question items require reviewing a set of data, analyzing that data, and then coming up with a conclusion about a nursing action. Does that sound familiar? That is critical thinking. So these types of questions tend to include more data than an average application question and require a higher level of thinking. These analysis questions, they may ask you to set priorities between several different clients or several competing priorities within one client, which is the example we have here. So this question, we need to incorporate all 3 of the P's. We need to prioritize, we need to be proactive, and we need to maintain patient safety. So, what do you think is the correct answer here? Well, the correct answer here is C, a stat dose of furosemide. Knowing what we know about the client and the client's symptoms, this would be the most appropriate action for the nurse to take. Great job, guys. So in conclusion, let's reflect back on our learning outcomes. So we have successfully been able to define and describe the terms critical thinking and clinical judgment. We have developed prioritization strategies for the clinical setting, including prioritization, being proactive, and patient safety. And we've also been able to apply the principles of critical thinking and clinical judgment to different clinical scenarios with our practice questions. So keep up the good work, keep flexing those critical thinking and clinical judgment muscles, and you guys will be expert practitioners in no time. Thanks for joining me, you guys. Take care.